Greetings, Neal family, and all our Camino supporters. My name is Tom Stockwell, and I'm the Executive Director of FibroFighters Foundation. Ella will be walking the 100-mile Camino route in early July. We are so proud of you, Ella, as you stand strong against the challenges this rare cancer presents. We are so deeply grateful for all your support over the past years, and now I would like to introduce you to our medical director, Dr. Paul Kent, so he can explain how your donations help patients like Ella. Buen Camino. Paul?
Hello, my name is Paul Kent. I'm medical director of FibroFighters Foundation. I am so proud of you, Ella, and your family for doing this. Thank you so much. It's so amazing, so awesome. I would like to highlight some of what donation money goes to. First of all, we work with this amazing platform called XCures. It allows us to have the first and only international tumor board, which means that people from all over the world get together to discuss your child's case, all free, of course, with your primary care doctor. Everyone in there has taken care of at least 20 cases of fibrolamellar carcinoma. Second, it allows us to do functional testing. What that means is we take your tumor or your child's tumor and we see which drugs work and which drugs don't. We give answer back to you within 10 days. It's the only approved lab in the country that does this in fibrolamellar carcinoma, the only one that's been CLIA approved and therefore validated. We also work with a group called Boston Gene. They look at understanding why some cancers are able to flourish. What they're trying to understand is the microenvironment. That's the area around a tumor that protects the cancer. And this is the only group that I know of that studies fibrolamellar in this way, so that we have another way of trying to defeat the cancer. In other words, trying to get rid of the protective elements surrounding the cancer. That's Boston Gene. At the same time, we're using the information we collect from people who sign up for XCures to publish data. We have larger sets than anyone in the world of fibrolamellar patients, looking at what therapies work, which ones don't work, when does radiation make sense, when does surgery make sense, and so on. Just in the last 6 months, we've published 8 different abstracts and posters, and all of them are being turned into papers. We work with a group called Signatera. This is, again, cutting edge, and again, it's free for fibrolamellar patients, and it looks at DNA from the tumor circulating inside your blood to see if we can still see any cancer cells in your blood. It helps tell us when you go to 0, which is what we want, remission, and also when it starts to go up again. It tells us if a treatment is working. The number of molecules in the blood go down. It tells us if a treatment isn't working. It starts to go up. We're also working on new clinical trials. University of Nebraska, a drug called cofactor, and hoping to launch bigger clinical trials using our new and novel treatment, Gemox lenvatinib, as the best way to shrink a patient's tumor. We invite everyone who is a member of the fibrolamellar community to sign up for XCures. After that, you're helping the whole world and you're helping yourself. It allows you access to the tumor board. It allows researchers such as myself and others to learn more about fibrolamellar carcinoma. Thank you so much for everything you've done. We love you, Neal family.